We're really only just discovering all of the ways that virtual reality could be useful. Here I want to give you 5 examples, including 3 examples from the Hopkins Centre, of how VR could be used in health and rehabilitation. And I hope that these might inspire you to think of ways that VR could be used in your area. The first example is the use of virtual reality for medical anxiety and procedural pain. And this is perhaps where virtual reality has been most used to date. Virtual reality is a powerful distractor. So whether you use a game or a guided meditation, the effect is likely to be one that significantly reduces pain and anxiety. Another example is the use of virtual reality in neuro rehabilitation. For example, here we have someone engaging in upper limb rehabilitation where they are reaching out and popping bubbles alternating between their right and left hand, forcing them to use a hand that perhaps they are otherwise neglecting or perhaps is weak. Now to some things that we're working on at the Hopkins Centre. And the first is something called virtual reality body image training. There's something that happens when you swap your real body for a digital body or an avatar, and that is that you tend to take on some of the perceptions and behaviours that are unique to the character that you're embodying. So for example, if you become the Incredible Hulk in virtual reality, then you'll tend to genuinely feel strong. And we're seeing if we can leverage that effect to help people who feel weak and vulnerable because perhaps they've had an injury and long-term pain, and we're trying to help them regain that physical confidence. Something else we're working on in a project led by Associate Professor Heidi Zeman is we're seeing whether we can map or assess people's spatial attention, which is something that can be lost after a stroke. So for example, we can ask people to try to find the upright 6 in a map that's full of sideways 6s and 9s, and we can measure the time that it takes them to find that 6 in different locations in order to assess their spatial attention. Another Hopkins project is one led by Professor Michelle Capitas, based around a virtual walking simulator. It's based on a similar idea to mirror therapy for phantom limb pain, in that it creates the illusion that a missing or paralyzed body part is still moving and still intact. And something about this and what it does to the brain has been shown to reduce pain. So that's 5 examples of how virtual reality is or could be used in health and rehabilitation. And I hope that inspires something for you in considering how you might use virtual reality in your setting.